and Assalamualaikum everyone. My name is Wan Omar Koyum bin Abin Baki, a year 1 student from Faculty of Medicine with Matric number A212452. So today I will give a speech about why empathy matters in elevating patients' care and doctors' satisfaction. So everyone, imagine walking into a hospital with scared, confused and in pain, but only to be met by a rushed, distracted doctors who barely looks up from the chart. Sounds cool, doesn't it? So, according to a 2024 study in the Journal of Patient Experience, more than 60% of patients says their doctor didn't truly listen to them during consultation. Isn't it alarming that in a profession built on healing, empathy, which is one of its most powerful tools, is often missing? So, as a future healthcare professionals, medical students, or even just individuals who will one day rely on the healthcare system, this issue matters deeply to all of us. Whether you are giving care or receiving it, empathy shapes the quality of that experience. I've studied the impact of the empathy in healthcare, both through academic research and real-world case studies. And I can tell you, empathy isn't just a nice to have. It directly affects patients' outcome, doctor satisfaction, and even the efficiency of our healthcare system. Today, I want to show you why empathy should be treated as a core clinical skills, not just a personal trait. So, I will explore 3 things. First, the growing lack of empathy in healthcare. Second, how empathy can be taught and practiced in medical education. And lastly, or the third one, the long-term benefits of empathetic care for both patients and professionals like doctors. So, let's start with the problem, which is the lack of empathy in healthcare. Even though empathy plays a critical role in healing, it's often undervalued in medical training. Many doctors are trained to focus solely on diagnosis, charts, and test results, while the human connection takes a back seat. That disconnection has serious consequences. So, according to research, 2023 Journal of Patient Experience study again, over 60% of patients felt that doctor didn't genuinely listen, and it's not just patients who suffer actually. The American Medical Association in 2024 reported that doctors who lack meaningful patient interaction are far more likely to experience stress, burnout, and emotional exhaustion. Shockingly, a Medscape survey found that more than half of healthcare workers feel unprepared to handle the emotional needs of their patients. This shows a gap in our training system, and it's one we need to fix together. And this isn't just a statistic. Think of the elderly patient who struggles to explain her system, or the teenager too anxious to voice his concerns. When empathy is absent, those voices go unheard and care suffers. So, how do we fix it? By integrating empathy into medical education. Some medical schools are already doing this, using tools like role-playing, problem-based solving, reflective writing, and real patient interaction. And it works. A 2023 study by the Lancet Medical Education found that students who went through empathy-focused training were rated much higher in patient trust and satisfaction. At the Cleveland Clinic, for example, first-year students participate in the mandatory empathy course, where they shadow patients, not just during diagnosis, but through treatment and recovery. That experience shapes how they see patients, not as cases, but as people. It's not just about making patients feel good. Empathy also helps doctors manage stress and prevent burnout. A 2024 study in BMJ Open showed that students who train in empathy develop better emotional regulation and resilience. Think about that. By practicing empathy, future doctors are not only helping others more effectively, but also protecting their own mental health. There's a win-win situation. And here is the key. Empathy isn't a fixed trait, it's a skill. Like learning to structure, read an ECG, it is improved with intention and practice. The earlier we make this part of our training, the more natural it becomes. So now, let's move to the next part. Let's talk about the long-term benefits of empathetic care. First, patients treated by empathetic doctors are more likely to follow medical advice and recover faster. A 2024 study from the Journal of Compassionate Healthcare found that patients were 40% more likely to adhere to treatment when their doctors showed empathy. Second, doctors benefit too. Practicing empathy leads to stronger patient relationship, greater job satisfaction, and less burnout. A report showed that the doctor who engage empathetically feels more fulfilled in their careers as a doctor. And lastly, on a larger scale, empathetic care actually saves time and money. The Cleveland Clinic reported in 2023 that empathy-based communication led to fewer unnecessary tests and reduced patient readmission. In other words, empathy makes the system more efficient. But beyond studies and report, this is about something deeper: trust. When patients feel seen, heard, and understood, they open up, they engage, they heal, and we as a caregiver become part of something meaningful, not just medical, but profoundly human. So, to wrap up, let's quickly review. We have talked about the growing empathy gap in healthcare, how empathy training can be integrated into medical education, and the lasting benefit for both patients and providers. So here's my call to everyone, to me and to you. Start now. Value empathy in your daily interaction. If you are a student, advocate for empathy training in your program. Join workshop. Practice active listening. Support a culture where emotional intelligence is just as important as medical knowledge. Let's not view empathy as optional but essential. As Dr. Francis Peabody once said, the secret of the care of the patient is in caring for the patient. By embracing empathy, we don't just become better healthcare professionals, we become better people. Thank you.